Crystal, how are you doing today?
My knees hurt a little bit.
Okay, yeah, so we have some tests we're gonna run today. First, we're gonna be checking for some ligamentous issues. Next, we'll be checking for some meniscal injuries as well. Okay, does that sound fine?
Yes.
Okay, so first test we're gonna do, I'm gonna do all the work. I don't want you to move your leg at all. You just let me do all the movement, okay?
Okay.
We're gonna bend this knee here. Now that we're bent, I'm gonna sit on your foot right here. First test we're going to be doing is a anterior drawer test to test that ACL. I'm going to hold on to that proximal tibia and we're going to pull anteriorly on that tibia. We're just looking for ligamentous laxity and recreation of pain or symptoms, but that looked good. While we're in this position, we're also going to test the PCL. Hands are going to go on proximal tibia and we're going to be pushing posteriorly. So normal movement is around 0 to 2 millimeters. Abnormal would be greater than 6. Also looking for joint laxity and recreation of symptoms.
So how did I do?
You did great. Looked awesome. Now we're going to test MCL. We're going to do a valgus stress test. Put that foot up by my elbow there. First time we do the test, we're going to do it at 0 degrees of extension, which is where we're at, nice and straight here. I'm going to be pushing your knee in towards your midline, and we're going to be looking for joint laxity and recreation of symptoms here. That looks good. Now we're going to repeat this test at around 20 to 30 degrees of knee flexion. Just relax that leg for me. Yep, relax. There we go. Looks great. Perfect. Those looked great. We're going to move on to our meniscal tests. For this one, we're going to be testing the medial and lateral meniscus. We're going to bring that knee into maximal flexion here. I'm going to find the joint lines with my thumb and fingers. And to test the lateral meniscus, we're going to maximally internally rotate that tibia there. And then we're going to extend that knee. Relax your leg for me. We'll do that again. Just relax. Internally rotate. And then come down and up. Perfect. Now for the medial, palpating same spots. I'm going to externally rotate. Come down and back up. Perfect. There we're just looking for recreation of symptoms, joint laxity, or any clicking or clunking sounds. Last test. Is it okay if I pull up your pant here really quickly?
Yeah, but I didn't shave my legs.
That's okay. No worries. Okay, for this one, we're just going to palpate the joint lines, looking for any tenderness or recreation of pains.
Okay, because that's really kind of where it's tender, is in there.
Okay. Well, since you say that's tender, that would be a positive sign there. Alrighty.
I mean, it wasn't like super bad, but.
Good job.